It's not a risk. It's a service.
It's an investment.
Yeah, it's
An
a
investment.
service and it's an investment. It's no different than K through 12 education.
It is no different.
Mhm.
So we can now move on to how do we
Mhm.
finance? Do we finance it like we do through K through 12, which drives people nuts because if you live in a wealthy neighborhood, your schools are better because you pay more taxes? I can't help you there because the Constitution says the power is not enumerated to the federal government or also the state. And that's why we're locked into that. We could amend the Constitution and fund K through 12 at the same amount in every jurisdiction in the country, but it'll take a constitutional amendment. Ethically, we should provide it. The next questions that we should be asking is who finances it and how do we pay for it? But that should be for every child born in the US. And in my idea is very simple. Child support or your food stamps. It is a debit card. You show up to George's office to get your 2-month-old well child exam. He rings it. He gets $300 for the visit. If he doesn't do the visit, he loses the money.
Uh-huh.
There's no friction. We don't need a United Healthcare. We don't need networks. You got a license to practice medicine in your state. That card works at those physicians that are licensed to do that. You ring it, you get that done. We're done.
So now I'm gonna throw a wrench in your theory here. You
Okay.
are coming from the perspective, okay, that every pediatrician and every family practitioner and every family nurse practitioner and whoever is providing the service is going to provide the same level and the same quality of service because they are ethical. And that is where we've gotten into trouble with this whole value-based care thing is the argument on the other side is we don't want to just pay people to churn out more procedures or churn out more interventions and have them not be good quality. And you and I have a hard time with that because we would never not do that because that's our ethical basis. But we know that there are people who don't.
Yeah.
There are people.
Most pediatricians do the right thing.
I think most pediatricians do the right thing, but there are some physicians and nurse practitioners, and whether they're pediatric or not, that see 30 well child checks a day, 40 well child checks a day, and they're not providing. I know
That
there
is happening. It
it
is
is happening.
happening.
Yeah.
And it happens in pediatrics, obstetrics,
Yeah,
everywhere.
it happens in all
So
kinds of
so
areas. And it's
so
and
when you
you
talk to
do have to
women,
have that value piece. You have to have
yes.
that quality metric value piece. And I think if you have that, you can help to control that. I think that's a fair, that's no different in my mind than direct to employer. It's just instead of it being the employer base, which I think has all kinds of problems, but
Yeah.
that's also a result of unintended consequences from economic controls in the past. But our employer based system really should push us into direct to employer. And then we have some other system to take care of kids who don't have that access to that.
And so I think if you do the math, somewhere between $40 to $60 per member per month would cover what we're already doing, including vaccinations. So for what it is, the routine, right? The cold, the asthma, things that don't need hospital care, you could go to a membership model,
Yeah.
Netflix. We can decide if you're a Medicaid, the state pays $40. You, as a physician, you can provide, you can say, I can do it for that amount or I can't do it for that amount. I don't know, your local school system might say, I pay $50. And you might say, I can't do it for that amount. I'll take the 50, but you got to pay me $20 extra a month because I'm not doing it. I can't make it work. And then the consumer will judge things like, are they open after hours? Can I talk to someone on Sunday? Do they send me to a specialist that costs me more money every time the kid wheezes? Do they just tell me to go to the ER when the kid has a fever? That's not really valuable for me because I'm already paying for that service. So they will switch to someone else who gives them the service they need. Um, right? And then
Sure.
it'll have to be financed differently. Maybe the school system in Lincoln decides it's going to provide that for all their school teachers because it's good for them and their productivity. For people that are truly indigent, then maybe it's a state and federal partnership that pays them some.